My name is Jen O'Neill. I am a 46-year-old mother of two boys with additional needs. I'm a social worker and I had my first heart attack, a SCAD heart attack, when I was 36 years old, which was quite daunting and scary. Since then I've had another 2 SCAD heart attacks. I am very passionate about raising awareness and education, and also money for funds into research for these types of heart attacks. And as such, I'm a member of the SCAD Research Australia Board.
5th of February 2016, I had another stressful day. My husband came home from work and we were eating dinner. All of a sudden I felt discomfort down my left arm and a distinct strange feeling in my left breast. I felt very nauseous. I dismissed the symptoms. Luckily, my husband, he didn't dismiss the symptoms so quickly, and he said to me, "I think you might be having a heart attack." He was a cop, and so he'd witnessed people having heart attacks, so he had that background. The medical team were confident, as was I, that this was a stress or a panic attack.
I guess I don't look like a typical heart attack patient, and so it's easy to be dismissed in the health system. As a young woman, I have a lot of stress in my life, and a lot of these heart attacks that I was having was being put down to having stress or a panic attack. And what complicates things too is that I also suffer from anxiety and depression, which I'm quite open about. And I guess it's easy just to jump to, oh, that wasn't a heart attack, that was a stress or a panic attack. So it was quite confusing, the incidents that I had, but it's part of my journey and it has certainly made me stronger.
Prior to the angiogram, a cardiologist sat down with me and explained the procedure. I will be honest, I did feel like a fraud, and I felt terribly guilty for abandoning my family, in addition to using up all these resources. Halfway through the procedure, the medical staff began rushing about and talking in hushed tones. After some time, the cardiologist came over to me and explained that there was in fact something going on with my heart, which surprised them.
My second heart attack was quite difficult for me, not only because of the emotional side of things, but also when I presented to emergency, I felt I wasn't necessarily believed. So easily to put down what I was feeling as stress or anxiety, and I felt I had to fight for my voice to be heard, and it was eventually, which I'm forever grateful. My third experience of having a heart attack was a little bit different. I had a cardiologist who was absolutely fantastic, and he really listened to me and what I needed on my emotional journey, but also what I physically needed, and validated everything that I was going through. Also pivotal in my recovery was the cardiac rehab team, the nurses, who were just absolutely brilliant in my recovery. I just worry that people present to hospital, and because they don't look like heart attack patients, they get dismissed, and there is a delay in their treatment, which is hugely concerning and could end up fatal. And that's why it's so important that we have this education and we have more research into conditions like SCAD, which is, heart attacks are usually male dominated, but women do have heart attacks.
And telling the nurse that I needed to get home to my breastfed baby. She advised me that I needed to understand there were more urgent cases that have presented, and I needed to be patient. I've since learnt that this is far too common in women who don't look like typical heart attack patients.
As women, we're running around and we're doing so much for everyone and not so much for ourselves, that it's easy just to say, oh, we're overworked, or we're juggling all these balls, but we really need to start putting ourselves first, and medical staff need to know of conditions like a SCAD heart attack, which is a heart attack is typically a male's disease and has been researched heavily with males, including rat male DNA, which makes it quite difficult then to treat a female someone who is on blood thinners and who is menstruating, who bruises easily, is extremely tired, running after two little kids. It's really hard when you feel not listened to and not validated, because the experience I had was quite real and did result in 3 heart attacks. That could have ended quite differently for me, but it didn't, and thankfully I'm here today to share my story. There's quite a number of us who have had these and will continue to have these heart attacks, but we don't know what causes it. We don't have a gold standard of treatment. We don't know the impacts of medication. The research we have is based on males, and women respond quite differently to that. So I'm quite passionate about raising awareness and education, not only in the medical community and with medical professionals, but also with society, and letting women know that if you don't feel right, you need to seek help and make sure your voice is heard, because it's just so incredibly important and could save your life.